Hello, viewers. Welcome to another interesting chat on the Connect TV. As part of the series with the startups, today we have Mr. Tala Sheikh. He's the founder of Biddano, which is a B2B health services, medical services platform. To quickly start the chat, Tala, how do you pronounce your name? Talaha. Talaha? Tala.
Yeah, it's Talha. Thanks a lot.
Talha. Okay,
Thanks a lot,
okay.
Kumar, for an opportunity. Thanks for having me.
And what does Talha mean?
It means a tree which never dies.
Okay. So,
It's a
and
tree from heaven.
let's sincerely hope that your startup also will go on and on. And,
Definitely. Yeah.
and to start with, tell us about the Bidano. Why this name Bidano?
Yeah, it's actually a long story. I will not be able to cover in maybe next couple of minutes. But I'll tell you the idea behind that. I mean, why did
Yeah,
we start Biddano, right, at the first place?
yeah,
So me, Ashok, we both are co-founders of Vidano. We were just sitting and chatting about the Indian healthcare ecosystem. Because personally, I'm coming from a healthcare background. I've been born and brought up in this ecosystem. I've seen a lot of people suffering into the value chain due to inefficiencies, and also the unaffordability of the medicines is becoming a huge challenge for the market who are actually requiring these services. So
yeah.
we decided, like, since we have skill set, we have relevant backgrounds, we have some understanding, so why not we build something which will help people to get access to the medicines, as well as get the medicines at the affordable prices from the local distributors, as well as just in time. In real time. So it means
Okay.
that if you wanted a medicine in maybe an outskirt of Pune or Mumbai or
Yeah,
wherever, right? Earlier you would have to travel like maybe 10, 20, 50 kilometers to get access to the proper healthcare.
yeah.
But now with Bidano, we wanted to bridge that gap, solve that problem with the help of technology solution. We wanted to make sure that India should not face the problem of availability of the medicine anymore, because we are living in a 21st century, in a technology world where all the problems can be solved. So with this mission we started that we will help people to get their medicines on time.
Hmm. So, what does Bidano stand for? You don't have to explain a long story.
Yeah. Bidano, basically it stands for a company which is helping people to get access to the proper healthcare services, as well as get their medicines delivered in less than 3 hours
No,
to
no. What
their
is
remote.
BIDDANO mean? BIDDANO. What does it stand for?
Yeah, the name doesn't actually have any meaning. It is just like, a random word came into our mind when we were
Okay.
just chatting. We were idealizing the entire concept and model. Okay, this name just came up like, we need to have an organizational name which will basically grow up to a multi-million dollar company going forward, and will be able to help millions of lives on a daily basis with their healthcare needs. So the name should be unique. It should be something that should resonate with what we are actually doing in the market or for the market. So going
Hmm.
forward, we are actually planning to add the definition to Bidano, which is a company which is like a trusted healthcare partner of everybody within the country.
Hmm. Because there's a bid in it, and also there's a no also. So that's where the
Yeah.
confusion in the people. Uh, so anyway, we'll say it's a unique name. It resonates dynamism and
Correct.
whatever. Yeah.
Correct.
So okay, having started this company, this is what now 5 years old, right?
Yeah, we launched Bidano in November 2016.
Okay. And who was the first customer?
So we started with the end consumers fulfilling the prescription orders. So what earlier was happening is, if I am a consumer, I'll walk into the pharmacy with my prescription. that pharmacy would not have the all the SKUs available, all the medicines available in his stock.
Yeah.
But if I need the medicine right now, I'll be struggling to get the access to the medicines, right? So with Bidano, what will happen is we'll have all the pharmacies in every city onboarded on our platform. You as a consumer will just upload your prescription, and all the pharmacies that are available within your geography, okay, will be able to showcase their value proposition, and you'll be able to select
Yeah.
from
You.
which are the
Yeah.
pharmacies
That's true. We
available.
understand. No, we understand that. Who was your first customer? Whom did you try this out with?
Yeah, it's the end consumer only, right? The patients, mainly the
Okay.
patients who are requiring the medicines urgently, or if we have to categorize it at a higher level, you're targeting the patients with acute diseases, right? Patients who requires antibiotic, or undergoing any treatment or operations or surgeries or anything of that sort,
So
right?
you
We
started
are
off as a
not
B2C. You started. It's a direct
correct,
consumer. You started off as a B2C,
correct. We
and then
started with
you.
B2.
Oh, yeah.
Then we have converted into B2B, understanding the challenges and loopholes into the entire B2B supply chain,
Hmm.
because of which the pharmacies were running out of stock most of the times, and they were not able to fulfill the orders of the end consumer within their expected time. So we have discussed the problems with them. Then we again went up in the value chain, started talking to the distributors who are supplying to the pharmacies, understood their challenges, and then we have realized that there is a huge gap between distributors, pharmacies, hospitals. There,
Yes.
the entire market is highly unorganized.
Yeah.
Okay, there are over like 1 million plus pharmacies, 65,000 plus distributors, processing 10 million plus orders on a daily basis across the country, and that too with ad hoc delivery solutions or fragmented delivery solutions, right? So every day pharmacy would end up entertaining 10, 20 people from different distributors, taking different products to a shop. So this entire model is highly inefficient, right? And there is a lot of resource wastage happening in the
Yeah.
B2B supply chain. So we
Yeah.
decided that let's build a technology platform where we will consolidate all the deliveries amongst all the distributors at a pharmacy level.
Yeah.
Because if you would observe, right, every city in India is having a dawa bazaar.
Yeah.
Okay, where so
Yes.
we have like from a completely third party perspective, we thought about it. We have seen the supply chain models. We understood that if there is one pickup location and one drop location, then why there would be so many trips which need to happen,
Yeah.
right? So if a distributors are located in 1 kilometer geography, and the pharmacy drop point, the pharmacy location is fixed, and pharmacy is ordering on a daily basis to those distributors, so why
Yeah.
every distributor is keeping their in-house delivery team or
Yeah.
right? So like that, we decided, let's build a platform. Let's switch from B2B, B2C to B2B. First, we'll bridge the gap between distributors and pharmacies and make sure our local pharmacies should never run out of stock. Whenever they need anything, they'll just have the a platform where they can get it in less than 3 hours and fulfill the demand of the end consumer. Then we will again launch or resume our B2C service and provide end-to-end B2B2C platform for the healthcare service providers, which are mainly pharmacies and hospitals.
Great, Tala. But going by your experience, is there any typical list of diseases or prescriptions where there is this kind of a frequent shortage or short supply happens? Any particular category of diseases or treatments?
Acute diseases, these are mainly acute diseases, which are basically requiring any types of antibiotics, any types of, or maybe in most of the cases even the oncology products or some of the critical
Yeah,
care drugs, right? So all these products are the products which pharmacies, they don't keep it in stock,
yeah,
right? They procure as per the requirement.
correct.
But if you consider the acute market, it's 65% of the total healthcare market, right? While
Oh,
chronic diseases such as BP, sugar, hypertension is only 37 or 35% of the market share of the total
oh,
entire Indian healthcare market.
that's going
They
by
have
value or by volumes? Acha.
both.
Oh,
Yeah,
more than 60% of the people have these kind of diseases, cancer, heart,
acute
and
disease,
those kind of things.
correct.
Oh,
Acute diseases, yes.
that's
So
shocking.
diseases which are like the short-term diseases, right? So
Yeah.
all these things. And
Okay.
the chronic diseases, when I'm talking about it, mainly includes BP, sugar, hypertension, which requires a monthly refill of the medicines, right? So
Yeah,
pharmacies know they have to keep maybe amlodipine 10 for blood pressure for this patient, 3 strips every month. So they keep the stock of these regular running medicines.
yeah,
But for the acute diseases, since there is a very high level of uncertainty, these guys are not using any inventory management system, any ERP systems to track the data of
yeah.
their nearby consumers and all. So they are not able to take the decisions whether to keep these products in stock or let's help people get their medicines on time.
Okay. But going by the COVID experience, there is general impression that the the general other diseases, other than COVID, they have taken a backseat, and generally those kind of diseases did not get much attention. What has been your experience?
Seen it in the previous like lockdown 1.0, where all the other diseases or the treatments were put on hold. That was mainly because of the mindset of the people. I would say, in my opinion, that people were skeptical in terms of going to the hospitals, clinics, and all because of widespread of COVID, right? And even
Yeah,
doctors were not entertaining those patients because they were highly occupied with the pandemic situation, right?
yeah.
So but in this lockdown we are not seeing it as a significant barrier, the COVID situation we are talking about. People are still getting the treatments, but yes, the ratio has still been reduced as compared to the pre-COVID levels. So if there are like 70% of the patients are admitted of COVID, there would be only 30% of the patients which will be undergoing a routine surgery or normal treatments.
Have you come across any shortages of COVID-related medicines like remdesivir has been in shortage and things like that?
Yeah. The shortage of remdesivir is there always, but we as a service provider, we are just trying to make sure like whatever demand is being generated in the market, whatever supply the distributors are having, our job is to just make sure that the demand, the supply matches perfectly on the ground, and we deliver them in real time, or we deliver them in the expected turnaround time. So the basically now the government and all the regulatory bodies are working pretty closely with the healthcare professionals as well as the committees to make sure there is a smooth supply of all the COVID related drugs or these critical drugs which are currently being required at a very in a higher volumes. We are making sure that we have is in fact established a separate special team to take care of all these emergency products which needs to be delivered in less than 1 hour to any part of the city. So we have launched this project across various cities where we are operational in, and we have a dedicated pilots to make these deliveries in less than like 45 minutes to 1 hour to the remote places as well as to all the health centers across the cities.
So right
So
now
whenever there
you are active in Andhra Pradesh. I mean Maharashtra and Andhra Pradesh. I say
and Gujarat,
Gujarat. These
Surat,
almost
Ahmedabad,
all the major cities in this.
correct.
So how many cities roughly so far?
So we are now we are a very small startup here. We are only in 6 7 cities,
Good enough.
but yeah, over the span of next 12 months, we are planning to expand operations into 25 new cities.
25 new cities. Okay. And how are you managing the logistics? You have your own network or you
Yes,
outsource?
we have our own network, and we also have an outsourcing model where in some of the places where we have a completely automated systems, then we outsource it to the 3PL players who are again being very supportive to Bidano during this COVID times, and in these difficult times. But the entire system is being managed by Bidano team.
How strong is your team?
Yeah, we are over like 120 people.
Not bad. Not bad at all. And what are the future plans? You said 25 cities. And of course, this
Yeah,
kind of a business also requires a lot of funding. So, what kind of
correct.
funding you had so far?
So we have raised over $1 million already from the market, and now we are raising our Series A funding, which is around up to $10 million.
Okay,
And with this, we are expanding to 25 new cities, launching this end-to-end healthcare supply chain platform, which is going to be, by the way, India's first and India's largest B2B healthcare supply chain platform, with over 1 lakh plus pharmacies and over 6,000 plus distributors across these 36 cities that we will be after the end of next financial year. So with this plan, we are planning to sort of optimize the supply chain as much as possible, make it more efficient, save a lot of money in the process, and pass on the benefits to various stakeholders such as distributors and pharmacies. And we are also planning to work very closely with the pharma manufacturers and launching a vertical of cold chain deliveries for vaccines and injectables, which needs to be transported in a temperature controlled environment. So we are integrating it with our technology platform, where even the temperature of all the SKUs can be tracked live on one single mobile application. So this device we are sort of making in partnership with some of our strategic partners in the market. So this is again completely ready. We are planning to launch it in next maybe 30 to 40 days. We are also in talk with couple of manufacturers to get the contracts of their vaccine transportation, as well as for the COVID vaccines. So this is a perfect timing for us to launch this product, and my team is working very hard to sort of make it happen.
there's the doctors and WHO have been saying that the pandemic is not going to die very soon. Even if this
Correct.
goes away, we might, Bill Gates said that we might have another viral attack.
Third
This
wave.
is going to be the end of it. So, in that kind of a situation, I think, are you gearing up to for the future medical requirements, health service
Definitely.
requirements?
Definitely. So we see, as you must be knowing, like we work very closely with the chemist associations. We work
Yes.
very closely with all the majority stakeholders. So we are
Yeah.
the exclusive partner of All India Chemist Association, right? So we are also working very closely with all the top manufacturers and distributors in the country to make sure the industry dynamics are aligned in terms of the mission and the direction of Bidano, right? Because
Okay.
we are like truly independent healthcare service provider, providing the order fulfillment and medicine delivery services to the entire country. So we have to abide to the policies, changes, regulations, and whatever the upcoming challenges that the industry is anticipating. We have to be making sure that we are completely ready for that, so that going forward, because of because of Bidano, people should not face any problem. We want ourselves to be capable enough to handle any situation that can be anticipated for future.
How's been the response so far?
The response is pretty well. In fact, you must be knowing, you must have read the recent PR of
Yeah.
Bidano. We have doubled down on our volumes so
Yes.
it was just not the happiest moment for us, considering the situation of the market. A lot of people have suffered, a lot of people have passed away. But what it actually highlighted was, Bidano was managed to provide services to these many people, right, during that time. And
Mm.
that's what is making us feel proud, that we are providing valued services to our esteemed customer base, and we are helping millions of people get their medicines on time, even in these difficult situations. So we have also launched an extended arm of Bidano, where all of our delivery boys and operations team are working over a weekend for free of cost to deliver the medicines to the people at their doorsteps, right? So we have
Okay.
launched a B2C delivery free for the people during this lockdown, in partnership with the chemist associations and local pharmacies, to make sure that people should not run out of the stocks of their medicines just because of any of these pandemic situations.
Great. You're focusing basically on the medicines now, or getting into equipment also, medical equipment and emergency
We
equipment.
provide services to everything, so it's
Okay.
complete healthcare package. So we work with diagnostic centers, we work with hospitals for surgical consumables. We work with ayurvedic distributors to provide services to even the ayurvedic supply chain stakeholders. We work with pharma, and we also work with FMCG OTC, which are being sold at a pharmacy counter.
Okay. So great, Tarka, nice talking to you. I think the basic outline, the underlining philosophy behind your company Biddano is Medicare when you require.
Correct, correct.
So I think with that note, let's say thank you very much. Thank you very much for watching the Connect TV channel. We are sure you liked our coverage. Please subscribe to the Connect TV by pressing the bell icon. Please subscribe by pressing the bell icon. Thank you very much.